access in our app. And I would say the best of all is the personalized counseling sessions that we offer here, wherein you will be given a mentor who will tailor a particular study plan for you after analyzing your strengths and weaknesses, and where you're good at and how much you need to study. And you'll be given a proper timetable and everything. And the mentor will be available 24/7 for you, who will clear all your academics doubts and basically anything. And he'll be like a buddy who will help you get through your examinations. And you can use my coupon code Dr. Sushma 20 for any discounts if you are planning to subscribe to any of our premium plans. And in the basic plans, you will get pre-recorded classes, live classes, and just the quick revision examination module. And in the standard plan, you will get pre-recorded classes, live class, and more importantly, the live doubt clarification sessions. And of course, the revision examination module will be there in the standard plan. And then in the premium plan, you will get everything: pre-recorded lessons, live classes, MCQs, and question bank, and live doubt clarifications, and more importantly, the one-on-one personalized guidance, which is very important. And then this is the upcoming timetable, wherein by the end of 5th March, we will be done with upper limb. And this is the upcoming timetable that we have. Please do read about these topics before coming to the class to make the most of it. And with that, I will be starting with brachial plexus. Guys, brachial plexus is that topic in first year MBBS, which, if you ask me, which are the top 5 topics that you will have to study before going to the examination the day before, I will say the brachial plexus is that number 1 topic which you will have to study before going to the exam. It is that important. Whether it is in your prof examination, whether it is in your practical examination, your entrance examination, brachial plexus is an extremely important topic for you, and you cannot afford to get any questions wrong in this, because if you don't know brachial plexus, it is assumed that you don't know anything in anatomy. So it is such an important topic, and you will have to study this topic in detail. And do not memorize, do not mug up. I will try to simplify this topic as much as possible, so that towards the end of this class, you will feel ki yes, I know brachial plexus. I have understood what ma'am is teaching. I've understood whatever that she taught, and yes, now I know brachial plexus. After the end of this class, just go back home, open your textbooks, and then just glance through, just read through what is given in the textbooks. And I can assure you that by tomorrow, you will have a proper hold on brachial plexus, and you will not get any question wrong. Right. See, let's first take a simple clinical case scenario in the beginning of the class, and I will tell you, or you will tell me what the answer is towards the end of the class, right? So we have a 28-year-old female who presents to the emergency room with weakness and numbness in her left hand and forearm. She reports a sudden onset of symptoms of after a traumatic event during delivery of her baby. Upon examination, you notice that she has a claw hand-like deformity in her left hand with weakness in the intrinsic muscles. Sensation is also reduced on the medial side of the forearm and hand. Which of the following nerves is most likely affected? So this is I think there is some small mistake in this question. It is not the 28-year-old female who presents to the emergency room with this complaint. It is a baby of this 28-year-old female who presents to the emergency room with weakness and numbness in the left hand and the forearm. And the baby had these symptoms after a traumatic event during the delivery. So this is the question. I have a baby in the emergency room who has come to me with a claw hand-like deformity. So this is the claw, the paw that the tiger and the lions make. So this is the claw hand-like deformity in the left hand with weakness in the intrinsic muscles. And the sensation is also reduced on the medial side of forearm and hand. So this is what the clinical presentation is. And the baby has come to me with a 28-year-old female. So which of the following nerves are most likely affected is the question, which we will answer towards the end of the class. After studying brachial plexus, you will give me the answer, right? Now, guys, first of all, what is brachial plexus? What is brachial plexus? Why do we keep talking about brachial plexus? Brachial plexus, we have two different set of nerves. right? We have spinal nerves, we have cranial nerves. What are spinal nerves? Spinal nerves are those which come from the spinal cord. Cranial nerves are those which come from the cranial cavity. Simple, easy to understand, right? What are spinal nerves? Spinal nerves are the ones which come from the spinal segments. We have the cervical spinal segment, thorax, lumbar, coccyx, and sacral. So this much knowledge we have about the spinal segments. The nerves which come from these spinal segments are called as spinal nerves. Each spinal nerve, let us say I'm talking about C1 segment, right? From the C1 segment, I have one nerve which comes out, which is my C1. This C1 nerve has two rami. One is the dorsal ramus, second is the ventral ramus. I have dorsal as well as ventral ramus from each spinal nerve. Dorsal rami is concerned with all our sensory aspect. For example, we have something called as dorsal column. Dorsal column helps us in proprioception and so many and we also have anterospinothalamic pathways and everything which come into the spinal cord and they carry the sensory segments. For example, one of the examples that I told you is the dorsal column pathway which carries, let's say, proprioception and vibration. Correct? This proprioception and vibration, all of the other, whatever the sensory pathways that are coming in, will be carried by the dorsal ramus. Whereas the ventral rami is something that is concerned with everything that is motor, whether it is nerve supply to muscles, whether it is nerve supply to any joints, whether it is any kind of movement, whether it is flexion, extension, medial rotation, lateral rotation, all of the motor aspects of the upper limb or motor aspect of any part of the body is concerned with the ventral ramus, whereas the dorsal is concerned with all of my sensory, such as vibration, proprioception, pain, temperature, fine touch, crude touch. All of this is concerned with the dorsal pathways, whereas the ventral rami is something that is concerned with my motor, whatever the motor thing that are there in the upper and the lower limbs. Fine. Now, brachial plexus. Brachium means so these are the plexus of nerves that eventually end up supplying my brachium. That is my arm, forearm, and my palmar muscles. This brachial plexus is actually formed by the ventral rami of the spinal nerves C5 to T1. Number one, first definition, whenever brachial plexus is asked, the opening statement, brachial plexus is bunch of nerves. It is a plexus of nerves that are formed by the ventral rami of spinal nerves from C5 to T1. This is the opening statement of brachial plexus, which you will have to write in your examination as well as answer in your viva. Done. Now, these five ventral rami are what are called as roots. Any nerve, as it exits a spinal segment, the first part of the nerve is what I call as the root, right? So these five ventral rami, they form roots. These roots further form trunks. These trunks further divide into divisions. These divisions gives rise to cords, and these cords gives rise to branches. Imagine, guys, brachial plexus to be a tree. What is the structure of a tree? How do you, when you look at the tree, what are the different parts of the tree? First you have roots. After roots you have a stem. We also call it as a trunk. From the trunk you have different divisions coming in like this. From the divisions you have different branches and you have different cords. Similarly, similar structure, apply the same analogy here. In the spinal segment, as the nerve exits, the first part is the root. After the root, I have trunk. After the trunk, I have divisions. After the divisions, I have cords. After the cords, I have branches. You should not go wrong with this order. You should not go wrong with this order. Write this order 10 times right now, or write this order 10 times after the class is over. So you have roots, you have trunks, you have divisions, you have cords, you have branches, right? RT, DCB, RT, DCB. We have a team called RCB, right? We have a team, a cricket team, which is RCB. Between R and C, just add a TD. Between R and C, just add a TD. TD. So RTDCB is the mnemonic here. RCB team, all of us remember RCB, right? Just between R and C, add two letters T and D, right? T and D is test and discussion. As you go further, you will have test and discussion classes when you're preparing for your NEET PG entrance examinations. Just added T and D between RCB. RCB, roots, chords and branches in the end. Between R and C, just add T and D, right? RTDCB is the mnemonic. You should not go wrong with this order. If you go wrong with this order, entire brachial plexus topic will go wrong. So, brachial plexus is formed by the fusion of ventral rami of spinal nerves C5 and T1. The 5 ventral rami form roots. Roots form trunks. Trunks separate into divisions. Divisions join together to form cords. Cords give rise to different branches, right? The end product of this, the end product of whatever I have told you until now, the branches, is the 5 major nerves which end up supplying my upper limb, that are my axillary nerve, radial nerve, musculocutaneous, ulnar and median nerve. Ulnar and median nerve. Understood? This is the introduction of brachial plexus. So when you are given the question of brachial plexus in your exam, opening statement is, it is formed by the fusion of the ventral rami of spinal nerve C5 to T1. Next, what are the separate parts of brachial plexus is RTDCB. This is the order. These are the different parts of the brachial plexus, and eventually all of this eventually terminates, or all of this eventually contributes into 5 major nerves that we have here. That is my axillary, radial, musculocutaneous, ulnar and median nerve. All these 5 nerves we've already covered in our previous classes. Next, this brachial plexus, guys, is about 15 centimeters long, which extends between my spinal column and axilla. So imagine somewhere here is the spinal column and somewhere here is the axilla. It runs for about 15 centimeters here in the neck region, as well as somewhat, in little bit about in the arm region as well, and it enters into the axilla. And from axilla, you have different branches coming. So basically, brachial plexus is about 15 centimeters long, which runs between the spinal column to axilla, right? Now, why brachial plexus as a plexus of nerves? Why are they there in the first place? They are there because they are responsible for cutaneous, that is the sensory as well as the motor innervation of the entire upper limb and pectoral girdle. Whatever the sensory and the motor innervations that I have in the upper as well as in the pectoral girdle, it is actually coming from my brachial plexus. It's actually coming from my brachial plexus, right? Yes. Now, it proceeds through neck, axilla, and finally it enters into the arm. Yes. Then, next point is talking about the relations of brachial plexus. Relations of brachial plexus. So I told you what are the different, parts where it runs through. It runs through in the neck, it runs through in the axilla, as well as a little bit enters into the arm, and then from there the branches take off, right? In the neck, where exactly I'm talking about, guys? I'm talking about the posterior triangle here. So where is this nerves coming? These nerves are coming from the posterior spinal segments, isn't it, guys? So where is the spinal cord? Spinal cord is in the posterior area, right? In the dorsum. So this brachial plexus actually lie in the posterior triangle. Then you can tell me what muscle is there in posterior triangle? Simple, platysma. And if you have to tell me in a complete order, vis-a-vis relations, you have skin. After skin, you have muscular layer, which is platysma, and then you have deep fascia. Is there anything to mug up here? So one point that you have to remember over here is, in the neck, brachial plexus lie in the posterior triangle. What are the other relations? What are the other things that are there? Either they may cross it or they may cover it. Brachial plexus are covered by skin, platysma and the deep fascia, and they are crossed by supraclavicular nerves. What are we talking about? We're talking about neck area. Anything above the clavicle is neck. So what is it crossed by? Supraclavicular. Supraclavicular nerves and the inferior belly of omohyoid. And what are the other structures we have? We have external jugular vein, transverse cervical artery, and so on. So in the neck, number one point, the brachial plexus, they are present in the posterior triangle covered by platysma, skin and superficial and deep fascia. Then they are crossed by supraclavicular nerves, inferior belly of omohyoid, external jugular vein, and transverse cervical artery. Then, as it emerges, right, as it further carries down, it emerges between the scalenus anterior and scalenus medius. It emerges between the scalenus anterior and scalenus medius, right? In the upper part, imagine guys, we have the subclavian artery running here, right? Subclavian artery further runs down as axillary artery, right? Now the subclavian artery somewhere lying here. So obviously the upper part of the brachial plexus will have to lie above the subclavian artery, whereas the lower trunk, which is formed by the union of C8 and T1, is placed behind the cervical subclavian artery, right? As the brachial plexus emerges between the scalenus anterior and scalenus medius, the upper part, the upper segment, imagine that this to be the subclavian artery, my brachial plexus is coming like this, right? From it is coming like this, and it's going behind the subclavian artery like this. The upper part is, where is it lying? It lies above the third part of the subclavian artery, whereas the lower trunk is placed behind the subclavian artery. Behind the subclavian artery. Then further, as it descends further down, see, from the spinal segment, the brachial plexus span out like this, and it is coming downwards towards axilla. As it crossed the subclavian artery, now it is lying behind the clavicle. Behind the clavicle, what muscles do we have? Number one, we have subclavian muscles and the transverse scapular vessels, which we did last class, and lies upon the first digitation of the serratus anterior and subscapularis muscle. So behind the clavicle, it passes behind the clavicle and the subclavius, transverse scapular vessels, and of course the first digitation of the serratus anterior muscle, which is serratus anterior muscle. If you remember, I taught you about how the muscle is inserted as digitations in the costal surface of the scapula, and how the paralysis of this results in the winging of scapula is also have been done in the previous class. So just a quick revision. So behind the clavicle, we have the subclavius, transverse scapular vessels, and of course it lies upon the first digitation of the serratus anterior and subscapularis muscle. Then in the axilla, it is related with the, it is placed lateral to the first portion of the axillary artery. Then it surrounds the second portion of the axillary artery, and then finally the medial cord lies medial to it. And then I'll tell you how the cords are placed vis-a-vis the axillary artery. Just know that in the axilla, the brachial plexus are in relation with the axillary artery, and it surrounds the second part of the axillary artery, and one cord lying medial to it, one lateral to it, and one behind it. And in the lower part of the axilla, it gives off the terminal branches to the upper limb. It gives off the terminal branches to the upper limb, and that is how the relations of the brachial plexus is. First, you have to tell where the muscle is actually present. That is in the posterior triangle of neck, and then further it descends downwards. And then we have to talk about the relations vis-a-vis the clavicle, and then finally before clavicle you have to talk about the or to talk about its relation with respect to the subclavian artery, then how it is related with respect to behind the clavicle, and then we have to talk about what the relations in the axilla are. Right? That is it about the relations of the brachial plexus. And now comes the most confusing, and I would perhaps say students get so confused and they don't understand the formation of brachial plexus. I'll try to make it as easy and as simple as possible. Never ever mug up this particular thing, guys, because never mug up the formation of brachial plexus. Because if you mug up, you tend to get confused. You tend to forget things, because once you forget one link here also, you will not be able to recall. So never try to mug up. This is a very simple topic. You just need to understand different terminologies and keep revising it again and again so that you will not forget it. It is as simple as this. Now, what is the formation of brachial plexus. How the brachial plexus are actually formed. Initially, I told you that brachial plexus is nothing but the fusion of the ventral rami of the C5 to T1. We have 5 roots. These roots are directly coming from the spinal segments, right? We have C5, C6, C7, C8 and T1. C5, C6, C7, C8 and T1. What are these? These are roots. What are these? These are roots. Now what happens? C5 and C6, they become very good friends. C5 tells C6 ki, you know what, मैं अकेला अकेला बोर हो गया हूँ. So and they tell C6 ki, come on, let's make friends with each other. And then C5 and C6, both of them join together to form a trunk. To form a trunk, right? C5 and C6 join together to form the upper trunk. Whereas C7 is that kind of guy who is, C7 is a single bechara guy who does not have any girlfriend or any boyfriend, and he's just continuing downwards, and he did not get any, proposal or anything. So C5 is that bechara who is just continuing downwards as such. He did not get any companion. Whereas C8 and T1, they both also found each other and they both also said, ki, ha, we both are very compatible and let's join together and let's form one trunk, which is the lower trunk. So what has happened until now? From the spinal segments, we have had C5 and C6 together, and we had C7, C8 and T1 together again, which formed different parts. So roots are my C5, C6, C7, C8 and T1. C5 and C6, they thought with each other that, they're very compatible and they joined together to form my upper trunk. C7 is that bechara single guy who does not have any boyfriend or girlfriend and just continuing down all alone. He did not get joined by either C6, C8 or T1. So he's just continuing downwards all alone. Whereas C8 and T1 also, they also got, befriended each other and they are continuing downwards as lower trunk. Now guys, C5 and C6 join together to form upper trunk. C7 bechara single continuing as middle trunk. C8 and T1 join together to form the lower trunk. Any doubt until now? We had roots C5, C6, C7, C8 and T1, out of which C5, C6 joined to form upper trunk. C1 is continuing as middle trunk. C8 and T1 joined further. They both joined together and now it is continuing as lower trunk. This much is understood. Further, each trunk divides into 2 divisions, right? Each trunk divides into 2 divisions. The first upper trunk also divided into anterior and posterior division. Middle trunk also divided into anterior and posterior divisions. Lower trunk also divided into anterior and posterior divisions. How many divisions do we have? We have 6 divisions. How many trunks did we have? We had 3 trunks. How many roots did we have? We had 5 roots. 5 roots, 3 trunks, 6 divisions. Now, continuing further down, we have upper and lower divisions from the upper trunk. Anterior and posterior divisions from the upper trunk. Now, this upper trunk is feeling bad for this C7 guy because C7 is all alone. He didn't get any girlfriend. So, what upper trunk did was it gave off his posterior division to C7. It gave off its posterior division to C7. Now, C7 is joined by the posterior division of the upper trunk. Initially, C7 was bechara guy. He was just traveling downwards. He didn't have any companion and he divided into anterior and posterior divisions. Now the upper trunk felt bad for this guy, right? C7 is bechara. He doesn't have anybody. So he gave his posterior trunk to C7. Posterior division to C7. Now, C8 and T1 joined together to form the lower trunk. Lower trunk again divided into upper, anterior and posterior divisions. Again, C8 and T1 lower trunk also felt bad for C7 guy. It also gave off its posterior division to the C7 bechara guy. Now, C7 is having so many divisions joining in. As such, C7 divided into anterior and posterior divisions. Now it got a posterior division from my upper trunk and also got its posterior division from the lower trunk. Now C7 is having how many divisions? It is having its own two upper and lower anterior and posterior divisions, and also it got its posterior division from the upper trunk and posterior division from the lower trunk. Now it is having four divisions. Now the C7 is having four divisions. Initially when C7 started, it didn't even have a single girlfriend, but now it is having four divisions. Now C7 is extremely overwhelmed. So it is saying, no, I cannot handle so many people around me. Now take one anterior division, and it gives off its anterior division to the upper trunk. It gives off its anterior division to the upper trunk. Now, until now, what the story is. C5 and C6 joined together to form the upper trunk, which divided into anterior and posterior divisions. C7 was a bechara guy who was continuing as such. He did not get any girlfriend, and he also divided into anterior and posterior divisions. C8 and T1 also joined together to form the lower trunk, which divided into anterior and posterior divisions. The upper trunk felt bad for C7 and he gave off his posterior cord to C1. Lower trunk also felt bad for C7 guy because Bichara is all alone. So he also gave off his posterior cord to C7. Now C7 is having how many divisions? It is having posterior division from upper trunk, posterior division from lower trunk, and its on to anterior and posterior division. C7 says, I'm overwhelmed. I cannot handle so many divisions. Take one anterior division, and it gives off its anterior division to upper trunk. Now, at this point, how are the divisions divided? Upper trunk is now having the anterior division of its own and the anterior division of the C7 middle trunk, isn't it? C7 had four different divisions, na? Its own anterior, posterior, and the posterior divisions of both upper and lower trunk. Now, anterior division got one, sorry, the upper trunk got one more anterior division from the middle C7 wala part. So, the anterior divisions of upper trunk as well as the middle trunk join together to form my first cord. Join together to form my first cord, which is my lateral cord. Lateral cord. Now, what is lateral cord having? Lateral cord is having the anterior divisions of upper trunk as well as the middle trunk. Upper trunk as well as the middle trunk, and that is the lateral cord. That is the lateral cord. Now, what is happening with the C7? C7 initially was a bechara who was continuing just like this. He didn't join, he didn't get joined by either C6, C8 or whatever. He was just traveling alone and he received so many divisions. He himself was divided into anterior and posterior, and he received the posterior divisions from both upper and lower trunks, and he gave off his anterior division to the upper trunk. Now the C7 wala, that is the middle part, the medial trunk, the middle trunk is now having three posterior divisions. The middle trunk is having all three posterior divisions. Posterior division from the upper trunk, posterior division of the middle trunk itself, and the posterior division of the lower trunk. Posterior division of the lower trunk, and further this posterior, all the posteriors combined together continues as the posterior cord. All the posteriors combined continues as the posterior cord. Now, what is happening in the lower aspect? The lower aspect, C8 and T1 joined together to form the lower trunk, which divided into anterior and posterior divisions. But again, C8 and T1 felt bad for C7, right? So they gave off their posterior division. Now C8 and T1 is having only one division, which is the anterior division, which further continues down as the medial cord. Further continues down as the medial cord. Understood? Understood till here? Further, these cords, which are those lateral cord, posterior cord and the medial cord, they give rise to different branches. They give rise to different branches, and this is the formation of brachial plexus, which is perhaps the most confusing, and the students find it so confusing and they don't understand, but it is easy to understand, guys. Remember this story, okay? What was the first start with, right from the basics, let us start. Let us revise whatever we have learned till here, right? Now, what was the different part, what was the different mnemonic that I had for different parts of brachial plexus, which is RCB, in the middle TD, right? RTD CB, this was the mnemonic I had. R for roots, then T for trunks, D for divisions, C for cords, B for branches. RTD CB. So this is the parts of brachial plexus. Sorted. Now, what are the different roots? Let's take each and every alphabet and try and understand. What are the different roots that we have? Roots are the direct continuations of the spinal nerves. What are the 5 different nerves that we have? C5, C6, C7, C8 and T1. These are the 5 roots. Then comes the trunks. What are the different trunks? C5 and C6, they join together and they form the upper trunk. C7 is the Bechara single guy. He didn't get any girlfriend, just continuing all alone, middle trunk. C8 and T1, again, they both found each other and they form the lower trunk. Upper trunk, middle trunk, lower trunk. Upper trunk is C5, C6, middle trunk is C7, lower trunk is C8 and T1. RT sorted. Let's come to the divisions part. Divisions. Trunks divide into anterior and posterior divisions. Every trunk, upper, middle and lower, all 3 trunks divide into anterior and posterior divisions, right? Now, upper trunk divided into anterior posterior, middle trunk divided into anterior posterior, lower trunk divided into anterior posterior divisions. Then, upper trunk felt bad for the middle trunk because Bechara C7 all alone hai. So, it gave off one posterior division to the middle trunk. Then, the lower trunk also felt bad for this Bechara, middle trunk, he doesn't have anybody. So it also gave off its posterior division to the middle trunk. Now, at this stage, what do we have? We have the anterior cord of the upper trunk. The posterior cord is joined the middle trunk. Now, the middle trunk is having the posterior divisions of all 3 trunks and its anterior division. So the middle trunk got overwhelmed and it is saying, I cannot handle so many divisions. I'm giving off one anterior division to the upper trunk. So middle trunk gave off its anterior division to the upper trunk. Now the upper trunk is having anterior division of its own and the anterior division from the middle trunk. They both join together to form the lateral cord. Come further down. Then, in the middle trunk, what is the scene? All the posterior divisions join together and they form the posterior cord. Then, further down, C8 and T1, they form the lower trunk, divided into anterior and posterior divisions. Posterior division is already gone up. Now it is having only anterior division, which continues down as my medial cord. Now, guys, just a question for you, food for thought. We could have also said, like how we are having here upper and middle and lower trunk here, we could have said upper cord, middle cord, lower cord. Why are we saying, why are we giving different terminology here? Right here in the trunks, what are we having here? We have an upper trunk, we have a middle trunk, we have a lower trunk. We could have had the same nomenclature here also for the cords, right? Here also for the cords and for the lateral cord, I would have said lateral cord is nothing but an upper cord. For the posterior cord, I would have said it is the middle cord, and for the medial cord, I would have said it is the lower cord. Why are we giving a different nomenclature here? It is because of its relation of these cords with respect to the axillary artery. Come back here to this slide. Now, in the axilla, the brachial plexus surrounds the second part of the axillary artery, one cord lying medial to it, one cord lying lateral to it, one cord lying behind it, which is the posterior cord. Now guys, the axillary artery is actually present here, right, on top of the posterior cord. So anything that is lateral to the axillary artery becomes the lateral cord. Anything that is medial to the axillary artery becomes the medial cord. Anything that is behind the axillary artery becomes the posterior cord. That is why we are not having any upper, middle or lower cords. We are having lateral, posterior and medial cords because of its relations with respect to the axillary artery. Further, these cords they give rise to different branches. Now let's take the example of lateral cord. Lateral cord. Lateral cord gives rise to LML nerves. Lateral cord gives rise to LML nerves. So whenever you hear the word lateral cord, you should say LML. Lateral cord, LML. Lateral cord, LML. What are these LML nerves? L is the lateral head of the median nerve. M is the musculocutaneous nerve. L is the lateral pectoral nerve. What are the LML nerves of the lateral cord? As you can see here, we are having lateral pectoral nerve. This is the musculocutaneous nerve and the lateral head of the median nerve. Lateral head of the median nerve. So, lateral cord gives rise to LML branches. Lateral cord gives rise to LML branches. Then, what lies behind the axillary artery? Posterior cord. What are the different branches of the posterior cord? Posterior cord, we have lunar branches. Lunar. Lunar branches or the lunar nerves are the branches of the posterior cord. Lunar nerves are the branches of the posterior cord. L for lower subscapular nerve. U for upper subscapular nerve. N for nerve to latissimus dorsi. A for axillary nerve. R for radial nerve. R for radial nerve. What are the different branches of the posterior cord? It is my lunar nerves. Lunar nerves is the mnemonic for the posterior cord. Lunar nerve is the mnemonic for the posterior cord, whereas my axillary nerve and the radial nerve are the most important nerves that arise from the posterior cord. Then we have the medial cord. The mnemonic for medial cord is M for U. M for U, meaning 4 M nerves and U for ulnar. What are the 4 M nerves that we have? M is the medial root of median nerve. That is a medial root which is coming from the medial cord. Median nerve is a big nerve. It has two heads or two branches, one from the lateral, one from the medial cord. So the medial aspect of the median nerve comes from the medial cord, and the medial pectoral nerve and medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and ulnar nerve. Ulnar nerve. So, right from the beginning, if I revise again, I had the roots C5 to T1, C5, C6 joined to form the upper trunk, C7 continued as middle trunk, C8 and T1 joined to form the lower trunk, trunks divided into anterior and posterior divisions. All three posterior divisions joined together to form posterior cord. Anterior division of the upper trunk and the middle trunk joined together to form the lateral cord. Anterior division of the lower trunk continued as medial cord. 3 cords: lateral cord, posterior cord, medial cord. Lateral cord, mnemonic LML nerves. Posterior cord, mnemonic lunar nerves. Medial cord, mnemonic M for U nerves. LML, lunar, M for U. These are the branches of different cords. Branches of different cords. For roots, what is a mnemonic? RTDCB, RCB, team. Between that, add a test and discussion. RTDCB, then further. First is the lateral cord, mnemonic LML. Posterior cord, mnemonic lunar. Medial cord mnemonic is M4Q. Why do we say it is posterior, medial and the lateral cord? It is because of its nature of relation with the axillary artery, and this ends the formation of brachial plexus from the ventral rami of C6, C7, C8 and T1 till the LML, M4 and M4U and the lunar nerves. All these nerves, so many divisions, so many cords, so many branches, all of these nerves together will help in the sensory as well as the motor supply of my upper limb. Right. Then we also have branches from the roots. We also have branches from the roots. So we have two branches from the upper root, just two branches. One is the dorsal scapular nerve. Look at it. Look at in the diagram, guys. From the root, I'm having this one nerve which is coming from C5, which is the dorsal scapular nerve, and another nerve which is having the contributions from C5, C6, and C7, which is my long thoracic nerve. If I have to talk about the branches of roots, I have just two branches from the upper segments, that is from the C5, I have dorsal scapular nerve, C5, C6, C7, I have long thoracic nerve. What's special about dorsal scapular nerve, guys? What is it actually supplying? See, when I say roots, where are this actually present? Apply some logic here, guys. These roots are coming from the spinal segment directly, right? Whatever the nerves that comes from the spinal segment, the direct contact is the root. That means the roots are closer to the midline. Do you agree with this? Roots are closer to the midline. So, this dorsal scapular nerve as well as my long thoracic nerve will have to supply those muscles which are closer to the midline. Do we agree with this? Apply the logic. Simple. Nothing to memorize it. Don't memorize it. This is all very logical, right? The branches of the roots, the dorsal scapular as well as long thoracic nerve, they eventually end up supplying the muscles which are closer to the midline. Now, look at the nomenclature. What is the name of the nerve? This is the dorsal scapular nerve. Dorsal meaning something that is in the posterior aspect. Scapula meaning something related to the scapula. And I told you, roots are something that are closer to the midline. Now, imagine that area of the scapula bone which is closer to the midline in the dorsum. Whatever the muscles that are attached in that border, the medial border of the dorsal aspect of the scapula, are supplied by the dorsal scapular nerve. Is there anything to memorize? What are the different muscles that do we have there? Rhomboides major, rhomboides minor, levator scapulae. These are the different muscles which are attached on the medial border of the dorsal side of the scapula that are supplied by the dorsal scapular nerve. That's it. Nothing. Don't make it complicated. Then we have the long thoracic nerve. Where is this long thoracic nerve coming from? It is derived from the C5, C6, C7 and it is coming on the anterior aspect of the scapula. What muscle is there in the anterior aspect of the scapula? Serratus anterior muscle. In the last class I had explained you, any injury to this long thoracic nerve will result in the paralysis of serratus anterior and that results in the winging of scapula. Simple and easy. Next, branches of the upper trunk. We have just two nerves again here. Nerve to subclavius and suprascapular nerve. Nerve to subclavius and suprascapular nerve. So, suprascapular nerve obviously will have to supply the supraspinatus and infraspinatus. That's it. Supraspinatus and infraspinatus. Then, lateral pectoral branches of lateral cord. What are the different branches of lateral cord? LML branches, right? Lateral pectoral nerve which supplies the, lateral pectoral nerve is something that supplies the pectoralis major and the clavipectoral fascia. Then we have the musculocutaneous nerve. Musculocutaneous nerve, we have already studied musculocutaneous nerve in detail, right? Musculocutaneous nerve comes from the brachial plexus. It pierces the coracobrachialis, lies deep into the biceps muscle, and it also ends up supplying the brachialis muscles. So all three muscles, all the BBC muscles in the upper arm in the anterior aspect is actually supplied by the musculocutaneous nerve. Musculocutaneous nerve, which further descends down as the lateral cutaneous nerve of forearm. This we have already studied this. What are the muscles supplied by musculocutaneous? Biceps, then brachialis and coracobrachialis. Yours is the coracobrachialis, musculocutaneous and continuous. So the lateral cord branches are my LML, that is lateral pectoral nerve, musculocutaneous nerve, and the lateral head of the median nerve. Then medial cord are the, what are the different branches of the medial cord we have? M4U. M4U, that is the medial pectoral nerve, medial cutaneous nerve to arm, medial cutaneous nerve to forearm, and the ulnar nerve. And finally we have the ulnar nerve and the medial root of the medial nerve. That's it. M4U, 4 M nerves and 1 ulnar nerve. Then the posterior cord is the lunar. Posterior cord is the lunar nerves, that is upper subscapular, thoracodorsal nerve, lower subscapular. Thoracodorsal nerve is also called as nerve to latissimus dorsi. Then the lower subscapular nerve, which supplies the subscapularis and the teres, major muscles. Then upper subscapular, lower subscapular, nerve to latissimus dorsi, axillary nerve and the radial nerve. Axillary nerve and the radial nerve. We've already covered all of these nerves in our previous class, and I've taught this in detail, how axillary nerve and radial nerve injuries result in different manifestations, different sensory as well as motor manifestations. We've already studied this in detail in the previous sections, right? Yes. So again, quickly revising everything just one more time, one last time. C5, C6 join together to form upper trunk. C7 Bechara continuing Akela as the middle trunk. C8 and T1 join together to form the lower trunk. Correct? So the upper trunk giving rise to anterior and posterior divisions. Middle trunk giving rise to anterior and posterior divisions. Lower trunk giving rise to anterior and posterior divisions. Right? Now, Bichara C5 and C6, which form the upper trunk, is feeling bad for C7. So it is giving one posterior division. You can see the color coding. The red one is the posterior division. And C7 itself is having its posterior division continuing downwards. C8 and T1 also felt bad. Bichara single hai, so they are also giving one posterior division to this guy. Now, he is having 4 divisions. C7 is having 4 divisions. Now, he's very overwhelmed and he's thinking, I cannot handle 4 divisions. He's giving off one anterior division here, as you can see, to the upper trunk. Anterior division is given by the C1 to the upper trunk. Now, the upper trunk is having its own anterior division as well as anterior division of the C7, which will continue further downwards as the lateral cord. All the posterior divisions join together to form the posterior cord, and just the anterior division of the medial cord descended further downwards. Lateral cord gave rise to LML nerves. Posterior cord gave rise to lunar nerves. Medial cord gave rise to M4U nerves, which are the different branches. So RT, DC, B. So entire formation till the end is done. Okay, entire formation till the end is done, till the branches is done. Next, let us now go to the applied anatomy. Applied anatomy. Guys, we have 2 important palsies here. I'll make it very simple. Don't don't really have this thing, that is don't really get confused, because you're having so many nerves, but you only have to concentrate on certain important points and important nerves. One applied anatomy I've already taught in the previous class, that is injury to the thoracic long thoracic nerve results in winging of scapula, which in itself is a question which is already taken care of. Other than that, we are having 2 different paralysis. One is Erb's paralysis, one is clump case paralysis. Erb's paralysis and clump case paralysis. Right? Now, Erb's paralysis, letter E comes before K. Meaning, whatever that is there in the upper segments, whatever that comes first in the upper area, injury to them results in Erb's paralysis, whereas the lower, the one which comes later, injury to them, such as C8 and T1, causes clump case palsy. Causes clump case palsy. Now, what is the causes basically? What are the different causes? Let's say a diabetic mother whose baby is having macrosomia. The baby is weighing 4.5 kgs, and then I'm trying to deliver by normal delivery, and the shoulder is stuck, and the aftercoming head, when it rotates too much laterally, something like this, the baby is rotating too much like this, that is causing a pull of the nerves here, right? If I rotate my my head too much like this, too much beyond what is permissible, that causes stretch of these muscles here, and the babies have very fragile nerves, and babies have very fragile structures. So any injury, because when there is a excessive lateral traction of the head, causes this different injuries like Erb's palsy and the clump case paralysis, right? Something like this. You can see when the head, when there is so much of lateral traction like this, you have a big head, big baby, that results in these two injuries: Erb's paralysis and clump case. Erb's paralysis can also be, caused if a person falls on his arm like this, or when there is a hyper abduction like this, or something falls on the shoulder, something heavy falls on the shoulder, may also result in Erb's paralysis. Basically, in Erb's paralysis, what exactly is happening, right? We have to try and understand what exactly is happening in the Erb's paralysis. In Erb's paralysis, the major root value that is involved is C5 and C6, right? C5 and C6, which is the upper two, C5, C6, we've studied, right? So the upper two, C5, C6 are actually involved, which causes Erb's paralysis. When they are injured, it causes Erb's paralysis. And what are the two important nerves that are involved? So one is the axillary nerve, another is the musculocutaneous nerve. We've already studied in axillary nerve, what is the important muscle that it supplies? Number one, deltoid, right? Number one, deltoid. Deltoid is essential for abduction, right? Deltoid, when it contracts, it causes abduction of the arm. So when there is an injury to the axillary nerve in this Erb's palsy, what happens? The person is not able to abduct his arm. The person is not able to abduct his arm, so his hands are always in adducted position. His hands are always in adduction. Then the second nerve that is involved in Erb's paralysis is musculocutaneous nerve. I've already told you musculocutaneous nerve supplies the BBC muscles. What are those muscles? Biceps brachialis and coracobrachialis. Biceps is a very strong flexor. It's a very strong flexor of my arm, and also it's a very strong supinator. So when biceps is the one that is responsible for this supination. This is supination, supine hand. This is pronation. Supination, pronation. Because the biceps brachii gets paralyzed here, the arm is always in a hyperextended state because the person is not able to adduct, flex. Person is not able to do the flexion movement, as well as a result, his arms are continuously in a state of adduction movement, adduction and hyperextension. Then, what is this? I told you this is called as supination. Because the bicep is injured, bicep is a very strong supinator, the arm goes into pronated position and it is in a abducted and hyperextended pronated state because of injury to musculocutaneous as well as axillary nerve. What are the different muscles that are involved? Deltoid, supraspinatus, infraspinatus, biceps and brachialis muscles. Erb's paralysis, injury, birth injury or trauma, root value C5, C6, nerves injured, axillary as well as musculocutaneous. What is the position of this? You can see here, the arm is adducted, hyperextended in a pronated state. Hyperextended and a pronated state. This is Erb's paralysis. Right. Look at it. Beautiful picture. So this is, look at this, how the hand is in a pronated position. In this baby also you can see pronated position, right? This is called as policeman's tip. So when a policeman cannot take money like this, he has to take under the table or like this, as if nobody is seeing. So this is called as the policeman's tip hand, where the hand is completely adducted, hyperextended, and pronated due to the injury to axillary and the musculocutaneous nerve. Then clump case paralysis. Let's say you're falling from a great height and you try to hold on to something. This hyperextension of the arm, which results in the clump case paralysis, like any traction injuries, fall. Basically, in clump case paralysis, the muscles that are involved are the palmar muscles. It involves C8 and T1. The two major nerves that are involved over here are the median nerve as well as the ulnar nerve, which supply the majority of the palmar muscles. I told you we have 20 palmar muscles, right? Thenar eminence, hypothenar eminence, lumbricals, pad and dab muscles, right? The interossei muscles, lumbricals, thenar and hypothenar eminence. Now, what are the different functions of these muscles? Pad muscles, palmar adductors, pad muscles, that is palmar interossei, help in adduction. Dorsal interossei help in abduction. Lumbricals help in this movement. These muscles together, when they work in synergy, it results in this particular position of the hand. When pad, dab and the lumbricals are working, it results in this particular position. What is this position? Flexion at the metacarpophalangeal joint and the extension in the interphalangeal joints. When there is any injury to the ulnar or the median nerve, what should happen? This position will be lost. When these muscles are working in synergy, it results in this position, this particular position that I've shown here. Whenever there is an injury to the muscles which are producing this, what should happen? Instead of flexion, there will be hyperextension. Correct? In MCP, what is exactly happening? In MCP, in a normal person, there will be flexion and all the muscles are working properly. And there is extension of this interphalangeal joints, right? When the muscles are injured, when the muscles are paralyzed, what should happen? It results in the hyperextension of the metacarpophalangeal joints and the flexion of the interphalangeal joints, and this is what is called as claw hand. This is what is called as claw hand. Normally, when in all of us who are normal, when all the muscles are working in synergy, the final outcome of the movement is this: flexion at the metacarpophalangeal joint and extension at the interphalangeal joints. When muscles are injured, there will be extension at the metacarpophalangeal joint, flexion at the interphalangeal joint. This position is called as claw hand. Also, because T1 is involved here, it results in the T1 is involved, it results in the Horner's syndrome. In Horner's syndrome, what do we have? We basically have anhidrosis, meiosis in ophthalmos, and T1 is the sympathetic outflow is thoracolumbar, right? To study this in pharmacology, what is sympathetic and parasympathetic outflow is. Sympathetic outflow is T1. This will be taught in physiology as well when you are studying aortic sinus and so on. So T1 is actually the thoracolumbar outflow. When T1 is injured, the thoracic segment is injured, it results in the one half of the face, loss of the sympathetic outflow of the one half of the face, anhidrosis, enophthalmos, and meiosis. So in clump case paralysis, we have two things: claw hand and my claw hand as well as my Horner's syndrome. Right? Two different paralysis, herbs and clump case sorted. Now, just I'll show you how to draw the brachial plexus. When you, even if you haven't understood anything, but you have to pass your exam, you can just follow this simple. First, you write a letter Y, then you write an I, again you write a Y. Simple. Then you will do this strike and a spare. See, you will do the strike and you will just do one spare. You will do this cross and this one spare. Okay. Let's assume you haven't understood anything, but you can at least follow this and write this diagram and get some marks. Then after this, you have to go on drawing these arches, simple arches everywhere. First you draw this arch, then you draw a second arch, Similarly, you draw this arch, then you do a second arch, this arch, then you draw a second arch. That's it. And then you draw some horizontal lines to separate these parts so as to tell you what is roots, what is trunks, what are divisions, what are cords, and what are branches. And now you can start labeling this. See, then you can start labeling this. Yes, that is it. All 5 important nerves need to be labeled, and this is how you write the diagram of brachial plexus. Diagram of brachial plexus. And you can, of course, go on adding different details about the branches of the roots, branches of the upper trunk, and so on. That's it. All right. Yes. So now let us take some poll questions. Just hold on for a second. I'll stop sharing the screen. Yeah. Let's just take some poll questions here. Okay. Now, first question. Which of the following nerves is not a branch of lateral cord? Simple and easy. What were the branches of the lateral cord? We had LML, nerves, musculocutaneous. Is it a branch? Does it come in LML? Yes. M is musculocutaneous. Lateral pectoral nerve? Yes. L is lateral pectoral. Lateral root of median nerve? Yes. L is lateral root of median nerve. LML nerves are the branches of this, and ulnar nerve, lunar nerves is posterior cords. Yes. Let's take another question now. Let's take another question. Yes. Which of the following muscles is not involved in Erb's palsy? Here, I didn't explain it then because here the answer is coracobrachialis, because the C7 component is spared in the musculocutaneous nerve and the coracobrachialis muscle receives its innervation from the C7 component, as a result of which coracobrachialis is the muscle that is not involved in the Erb's palsy. Erb's palsy is due to 2 nerves, axillary nerve and the musculocutaneous nerve, and coracobrachialis is the one that is not involved here. Yes. Then let's take one more question. What is the root value of axillary nerve? This you have to know because axillary nerve is one of the major nerves. There are 5 major nerves that I told you. These C5 and sorry, I just gave off the answer. So C5 and C6 is the root value of the axillary nerve, which you have to know because all 5 major nerves root value you must remember, right? So that ends up the topic of today, which is the brachial plexus. And I could not finish the other 2 topics, that is the pectoralis major and minor muscles. And yes, I will conclude today's class. And if you have any doubt, at all, you can always reach out to us, and whatever the topics that were left out will be covered in the next class. And I hope this class was useful, and I hope you've learned something about brachial plexus today. And I wish you all the very best. And if you have any doubt, you can always reach out to us across our social media handles. And thank you so much, and good night.